So CheckMate-274 is a phase 3 trial that randomized patients who underwent cystectomy. So these were the patients with bladder cancer or upper tract cancer who had either gotten neoadjuvant chemotherapy or who were not considered to be chemotherapy candidates, but after cystectomy still had a lot of residual disease, so at least T2 disease or higher. So they were randomized, about 353 patients, to nivolumab as adjuvant immunotherapy compared to 356 patients who were randomized to placebo. Now, majority of those patients did have bladder cancer, about 79% of them. 40% of them had PD-L1 positive disease, about 58% had T3 disease, and 47% had node positive disease. So the reality is CheckMate-274 is the first registrational trial on adjuvant immunotherapy that actually met its primary endpoint of disease-free survival. So they had two populations, so the intent to treat population as well as the PD-L1 population of patients, and both were statistically significant. So in the ITT population of patients, adjuvant nivolumab disease-free survival was about 21 months compared to the placebo, which was about 10.9 months. Whereas in the PD-L1 population of patients, it was actually not reached versus 10.8 months in those who got placebo. So that translated to a hazard ratio of like 0.53 in those PD-L1, and the intent to treat was about hazard ratio of 0.7. So very positive trial. So the question now is whether we can translate this. Is it practice changing? So questions really include whether or not we would consider disease-free survival as a really good surrogate or adequate surrogate endpoint for overall survival, because remember, overall survival is not yet mature and it's not the primary endpoint for this trial. Recall also that this is but one of the 3 adjuvant immunotherapy trials that we have currently either reported or ongoing. So last year at ASCO, we recall the results of IMvigor010, which is the adjuvant atezolizumab, and that did not meet the primary endpoint of disease-free survival. So it was like 19 months compared to placebo at 17 months. Now, we still have perhaps a tiebreaker study, which is the Ambassador trial, which looks at adjuvant pembrolizumab. So that trial has not yet finished its accrual goals. So I do think all these studies may further elucidate the benefit of immunotherapy. So I do think the data is out there, but we'll have to see if this translates to regulatory or acceptable for regulatory approval for widespread use in metastatic or advanced adjuvant therapy for urothelial cancer.